This is Abia COVID-19 update.
Abia COVID-19 update.
So what we want pressmen to help us do is to tell the general public that COVID-19 is real. It's not really exciting caring for them. If you wear that PPE, ask the cameraman that went in, if you wear that PPE for 30 minutes, then you know the discomfort that the health workers are going through managing this patient. So nobody will just be saying, we are managing COVID-19 patients for the fun of it. It is not funny. It's not. So please help us tell the general public that it is real, that you have been here to the center and we wanted to protect you. So we said you can't all go there. You will not be able to take the IPC procedures, the infection prevention and control measures. You will not be able to take them. To wear that PPE, you are supervised. To remove it is even more taxing. You are supervised so that you don't infect yourself. That's why we wouldn't take all of you in there. So please help us tell them that it is real. We have 5 patients here on admission. We're managing them and we'll be glad if we don't get more. But if indeed we get more, we will also manage them.
Well, that's from the guided visit to the isolation center yesterday. The voice of the chairperson of the Nigeria Medical Association, Abia State Chapter, Dr. Caroline Iwoha. Well, you will get more on that visit, exclusive visit this morning on Abia State COVID-19 updates. Markets in Abia State are currently open. You know that we are presently following the policy of operating markets Mondays, Wednesdays, and Fridays, 9 a.m. to 3 p.m. So as you go out today for work to buy necessary food items, use your face mask. Avoid unnecessary contact with people. For the sellers in the markets, ensure provision of sanitizers and the hand washing facilities and the use of your face masks too. It's very important. This is Abia State COVID-19 update, the last edition for the week. My name is Michael Oni. Well, on this program, we highlight the daily report of the Interministerial Committee on Control of COVID-19, as well as the Abia State Governor, Okezie Pazu's efforts in ensuring that the state is safe from the virus. It is running simultaneously every weekday, Mondays through Fridays on several radio stations in the state. We're live on BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM. Earlier, I told you about the exclusive visit to the COVID-19 isolation center at Amachara's Teaching Hospital in Umuahia, the capital of Abia State. And well, I can authoritatively confirm the presence of 5 COVID-19 patients at that particular isolation center. The video of that visit will be out today. We need to, censor the identity of the patients. It's very important as we protect the identity. So the video will be out today. The video, but we also had a conversation with the lead resident doctor, Dr. Stanley Okeruru, who gave a general history of the patients present at that isolation center. Let's listen to him and we'll start the conversation today on the program.
Who are senior to me, but they come for supervisory purposes. There are 5 of them. 3 of them came in from Lagos, but 2 are residents here and have not traveled in the last few weeks. So one of them is 63 years, the oldest, 62 years, the oldest. The next to him is 60 years. There's another one who is middle-aged, 43 years. Then there's another one who is 30 years, and the last one is 19 years. All of them are males.
So they're all responding?
Yeah, they're all responding to treatment. Yeah. What part of our management is to allay their fears, calm them down, which we did from the inception of receiving them. We'll calm their fears down. Though one of them still had tensions, BP rose up to about 170 as of yesterday, 170 something as of yesterday. But after talking to him and allaying his fears and giving him some medications, he's much better. Today the BP came down to 130 and he's doing fine. The one of 30 years. So imagine somebody of 30 years having BP of 170 something. It's just fears. But we've been able to come back. So this morning he recorded 128 and 130 over times of checking him because we monitor them closely. We are on a 14 days target of treatment. For the next 14 days we'll be treating them. Around close to the end of the 14 days we'll take a sample from all of them because they all presented on the same day. We'll take a sample from all of them to see if it's negative.
Do you go home?
No, I don't go home because we're on we're also like on isolation ourselves, or we are being quarantined as well because we are treating COVID-19 patients. So we have accommodation where we stay if we're not on shifts. I and the second doctor run 2 shifts. I stay in the morning, he goes in the evening. By next week we swap. And nurses run 2 shifts too, so that we limit the number of times we go in. So averagely in a day we go about 3 to 4 times. Because if we go back to our family, we are putting them at risk of the infection. Some of you that went in with our PPE would test a bit. They're just testing a bit.
I mean, just tell me about that experience.
Yes, a bit. It's hot. By the time you wear that overall, you start sweating immediately. You start burning inside. So, and you have to do that for about over 1 hour. You'll be with the patient, taking their vital signs, treating them. So it's very, very sad. It's very, very challenging. It's a period when you're making up your mind, use yourself, because you don't want much tension apart from the tension of the heat you pass through inside and thinking of, let me not be infected by these patients. It's a horrifying moment.
Oh, well, the experience of one of the frontline health workers there fighting COVID-19 in Abia State. Well, this morning we're joined on the program, Abia State COVID-19 update, by the chairperson, Abia State chapter of the Nigeria Medical Association, Dr. Carol Ejiro Iwoha. Glad to have you join us, madam.
Thank you.
All right. Well, interesting. You're one of the frontline health workers, in war situations. So we have soldiers leading the war, leading the battle, rather. Now, you're the soldier, one of the soldiers at the front line leading this battle. What does it feel? What does it feel like?
Thank you very much. One basic thing here is that the doctor was trained for times like this.
Okay.
It's part of the things we expect in the course of managing patients. There are several health conditions that can present de novo. COVID-19 is new, and there will still be, we have a group of diseases that are called emerging and re-emerging diseases. So it's something to have anticipated.
Something to have anticipated. Now, at this level, because I have some of my colleagues that visited the isolation center there at Amachara Teaching Hospital, and you took them around. At this juncture, some persons are still saying that COVID-19 is not real. What's your message for them?
I'd like to tell Abians that COVID-19 is real. And the basic reason why they should understand it is the fact that it's not just a disease that is peculiar to Abia State. It's a pandemic. It's occurring all over the world. It's in Nigeria. We hear the numbers of cases being diagnosed every day across the country. And this illness is transferred from person to person. So as long as people are moving and people have the virus, then there is the tendency that some other people will get it if they don't take the necessary precautions. So I want to appeal to Abians first to acknowledge, I must acknowledge at this point, the commitment of the executive governor of Abia State to this fight. And as I look at it, I ask myself, what is government gaining? It's all a project that was not captured in the budget. So it's a project that government has to face. And there's no gain in this project. If it was an investment program, an agricultural program, so you say government is going to get dividends. But in this case, it is government giving back to society, giving back to the people that they're leading. And they're making conscious effort to ensure that everyone gets protected, and if you get infected, get treated. So I want to really plead with Abians that this is real. It's not just a propaganda. It's a concern that is very worrisome, and we should accept and conform to the medical experts' advice, to the government directives that has been given with regards to control of COVID-19 in the state.
Let's talk about the symptoms now. For those at the isolation center, I believe that according to what we've read, some do present with mild symptoms, while some do present with some extreme symptoms. Now, for those that are in the isolation center there at Amachara, which you were present yesterday, according to my colleague now, Are they stable? Are they medically stable? What about the symptoms that they're presenting?
Okay, so the patients are stable. They have a few, one of them specifically has several of the symptoms, but they're responding to treatments and they're doing fine. They're stable.
Now, we've had issues where some persons will say, well, we do not believe, but we want to pay a visit to the isolation center. We want to see them. In fact, we want to have a handshake with them. I know you have a message for such person.
I want to plead with such persons that it's not a risk you would want to take. And that is why when the press crew visited yesterday, I told them, we don't want to risk all of you going in there. Because already you should know that in terms of greetings, handshakes are no longer acceptable. We say don't shake hands with people, don't hug people. Why? This is a droplet infection, and when people cough or sneeze, some of these droplets can be, you've seen several people cough with their hands to their mouth, I'm sure, and somebody coughs his hand to his mouth and you come and shake hands with him and he has COVID-19. So you're going to pick some of that droplets that are in his hands. Remember, they're not visible, and the next minute you're either rubbing your nose or your eyes or your mouth, and the virus gains access into your body. It's just as simple as that, and it's highly contagious. Like we've said, the ease of getting it is so high. So I want to plead with those people that want to get in there first before they believe that. Don't bother. Like I said to the men yesterday, the pressmen, that nobody would, it has changed the whole space of medical care. Nobody would just make up a story and start wearing those very uncomfortable garments.
Now let's talk about your
patients.
experiences wearing the PPEs. I understand that you feel hot when you're in the PPE.
Yes, those PPE are not comfortable, the kind of material they are made of. And they are made of such materials so that the health worker can be protected in case those droplets get in touch with you, such that it cannot penetrate and get into your body. So they're not comfortable, but we don't have a choice. Like when people go to war, this is a war, we have to fight it, we have to defeat it, so we use them. It's the part of the instrument of the warfare, so we use them.
Interesting. It is still Abia State COVID-19 update, the last edition for the week. We take a breather now. When we return, we will open the phone lines, talk about some of the precautionary measures you should, adhere to. We have a doctor right here in the studio, Dr. Ejiro Iwoha, Karu Iwoha, the chairperson of the Abia State chapter of the Nigeria Medical Association. The program runs simultaneously on several radio stations. This is Abia COVID-19 update.
Abia COVID-19 update.
It is still Abia State COVID-19 updates live on several radio stations in the state: BCA FM, Flow FM, Vision Africa Radio, Buzz FM, and Real FM. Now let's quickly do the figures. As of 7:50 a.m. today, Friday, the 22nd of May, 2020, globally, we have 5,199,016 infections of coronavirus being recorded, and leading to the deaths of 334,698 people. 2,084,729 people have recovered. And, well, of course, Nigeria's tally of the confirmed COVID-19 cases rose to 7,016 yesterday, as 339 new infections were announced by the NCDC. That's the Nigeria Center for Disease Control. Nigeria has so far tested 40,043 persons since the beginning of the pandemic. Now, a breakdown of all the confirmed cases so far shows that 1,907 have recovered and have been discharged. Of course, we have one medically managed and discharged case in Abia State. Now, that leaves us with 6 active cases in the state. We have 211 deaths reported across the federation. Now, we still have the chairperson of the Abia State chapter of the Nigeria Medical Association, Dr. Ejiro Carol Iwoha. She's also a consultant public health physician. Now, I want you to take us through the reasons behind making use of face mask. We've had reasons to be mocked on the street when you have persons mocking you just because they feel that you're obeying to the guidelines being outside by the NCDC, and they are still thinking that coronavirus is not real.
Okay, thank you very much. Let me say here that just flashback. Have you had somebody sneeze at your face before? Somebody just, sneezing can be spontaneous. And you were just close to somebody and the person sneezed. I'm sure you could recall that some saliva got to your face.
Droplets.
Yeah. So that is exactly why we're saying use the face mask. This infection is a droplet infection. So when you put on your face mask, it creates a barrier protection for your nose and your mouth. The reason is the nose and the mouth are open. They have what we call membranes or linings that this virus can easily attach to and then get into the body. So that is why we're saying use your face mask, because you don't know who is speaking to you. You don't know where he's coming from. You don't know who he has interacted with, because we talk of people that are contacts of people that have had it. So when you use your face mask, you're actually protecting yourself and your neighbor, and vice versa. So don't laugh at people using face masks. Don't use them as chin masks. Use them to cover your nose and your mouth, because when you do that, you're protecting yourself. It's not just one thing government wants you to be doing. And so when you get close to a police checkpoint, you say, oh yeah, everybody cover your nose and your mouth.
When you're not protecting yourself because of the police, but because of the virus. Now let's open the phone lines. We want to hear from you this morning. 0808 182 6949 or 0811 605 2949. Also drop messages on 0906 510 8289. It is Abia State COVID-19 update live on several radio stations in the state. Abia State, God's own state. Good morning to you. Hello, good morning. Hello, good morning to you.
Hello?
Yes, good morning.
Morning, sir.
Good morning. Can you speak up, please? Okay, we have to move on. Hello, good morning to you. We lost that. 0808 182 6949 or 0811 605 2949. Hello, good morning.
Hello?
Good morning to you. Hello, good morning to you.
Hi, good morning.
Yes, good morning.
Madam, good morning, ma.
Good morning.
My name is Uwakwe Chidebere. Madam, kudos to you people, more especially those of you that are on the front line. God will continue to guide all of you.
Amen.
My message to those doubting Thomas is they should go and have fellowship with those guys at isolation center in Amachar so that they can easily believe that there is COVID-19 in Abia State. What gain will have the state government get by selling lies to the people? Very unfortunate that we have such people. We still have such people in our environment. But all things being equal, if you don't have people like that, I don't think that things can move. But yes, if you see that there is no COVID-19, please forget about what Flo FM is saying to amateur. Go and have a handshake and one-on-one talk with them. After 1 week, whatever you see on your body, you take.
Yeah, all right, wrap up your thoughts, although we do not encourage that.
Working with you at amateur.
Thank you very much, Uwakwe Chidebere. Hello, good morning to you. We lost that. Let's see if this will pull through. Hello, good morning. Okay, we lost that. It seems to have issues with the lines this morning. Now, I would like to take you on the guidelines concerning hand sanitizer usage and washing of hands regularly with soap and water. Highlight the importance of going through these processes.
Very quickly, I'll say that one of the fortunate things that has happened to us is that this virus is also fragile. As contagious as it is also fragile. So our soaps and detergents can remove, it has something that protects it. It has a protective covering. So our soaps and detergents can remove that covering and it becomes, call it useless. It becomes powerless. So that's why we're saying wash your hands, not just with water, but with soap and water. Because if you had touched a surface or if you had come in contact, our hands keep moving. They keep moving. So if you've come in contact with the virus somewhere, when you get to the next point and you wash your hands, you deactivate whatever viruses you have picked. Not even just the coronavirus.
You can also make use of hand sanitizer.
Yes. Now coming to the hand sanitizers, we say alcohol-based sanitizers. But then let me use this opportunity to appeal to all those that are producing sanitizers. The ideal concentration of alcohol is 70%. Please don't produce sanitizers that have less than 70% alcohol because they will not kill the virus. So we'll just be rubbing some stuff on our hands.
I think I should ask you this question. This is coming from Chijioke from Umar here on the SMS line. How long does sanitizer last before its efficacy is lost?
Okay, now it lasts for several minutes, definitely, because as long as before it totally evaporates from your hands, it would have done the work that it's supposed to do. So we say frequently, as your hands keep getting contact with surfaces, the next point you get to, use your sanitizer. That's why we encourage have one with you every time.
Okay, let's entertain more calls. Hello, good morning to you.
Hello, good morning.
Good morning.
My name is from Abia State.
All right, well, welcome, Joy.
Good morning, Dr. Adiro.
Good morning.
Please, can I ask you a question?
Go ahead,
The
please.
option of using handkerchief in place of face mask, is it advisable? For instance, I move in the mirror, then I remember I see people with face mask, then I now remember mine. Then I go, maybe I can't go back, then I use my handkerchief. I potentially that it's not right using handkerchief in place of face mask. Thank you very much.
Well, again, I'll say that the issue is protecting direct contact with aerosols with droplets that may contain the COVID-19 virus. So if you don't have your mask, please use the handkerchief, but treat that handkerchief like a mask. Not when you finish using it to cover your nose and your mouth. The next minute you're using that same handkerchief to clean your eyes and your nose. So if you forgot your mask and you needed to use the handkerchief to protect yourself, treat that mask like a mask. Treat that handkerchief like a mask. When you get back, you wash it with, we advise detergent, some bleach in it, and then you know that it is sterile and safe for use.
Hello, good morning to you.
Hello.
Yes, good morning. What's your name?
Morning. My name is.
Can you
Good
speak up,
morning,
please?
Yes. Good morning, ma.
Good morning.
Yeah, my name is Timnak Keze. I'm calling from Umar here.
Okay.
I want to ask a little question. For instance,
Can you speak up, please?
Okay, I will. For instance, the patient escaped out of the hospital. What you guys plan to treat or to kind the person or to treat the person for instance, the person escaped out of the hospital.
Okay, thank you very much for that concern. Presently, when the patients come, we counsel them on why they're there. And again, I want to commend government for providing meals for them, breakfast, lunch, and dinner. So we encourage them, we counsel them that they will be fine with us. It's just a short while they would go. Food is being provided for them, and they should just see it as some time off their routine lives. And so if any patient is comfortable at the center, he doesn't have need to run away. So that is also the message we want to give to those that may come in. If we have more cases, you don't need to run away. Just go through your management period until you become negative and you're discharged to go home. So that is the message.
Hello, good morning to you. We lost that. Hello, good morning. Okay, keep your calls coming. Let's see if we can take two more calls before we wrap up things here this morning. The last edition of Abia State COVID-19 update for this week. Hello, good morning.
Hello, good morning.
Yes, good morning to you. Watching.
My name is JT and I'm calling from Abombi.
You're welcome.
Yeah, please, I want to know, whenever I say...
Oh, okay. Hello, good morning to you.
Hello?
Yes, good morning.
Hello, good morning.
Good morning to you. What's your name?
My name is Shudok. I'm calling from Ashiki.
All right, you're welcome.
Yes, I am appreciative of all your contributions in sensitizing people. But my contribution is that the government will do more in sensitizing people more and more, especially people in the remote areas. Yes,
all right.
They need it. They need it.
All right.
Some of these people are not aware of what is going on.
Okay.
And there is one question I want to ask again.
Quickly, please. Our time is fast spent.
Is every cough and sneeze and high temperature a symptom of COVID-19?
All right. Thank you. In 30 seconds, doctor, because of our time.
Yes, not every cough and sneeze is a symptom of COVID-19. So if you have such symptoms, that is why we do a test. We don't just move people to the isolation center or treatment center. It's only when your test comes out positive that we do that.
All right. In case you're feeling unwell and you have symptoms like fever, cough, and difficulty in breathing, call the Abia State Telehealth Initiative toll-free line 0700 2242 362 0700 2242 362. Many thanks to Dr. Ejiro Carol Iwoha, a consultant public health physician, for joining us this morning on the program. Thank you.
Thank you very much. It's been my pleasure.
Thank you, Doctor. And many thanks to the partner stations BCA FM, Flow FM, Vision Africa Radio, Buzz FM, and Real FM. My name is Michael Oni. The program returns on Monday. Stay safe and take responsibility.
This is Abia COVID-19 update. Abia COVID-19 update.